Hello again, it's Dr. D with Salisbury Eye Care and Eyewear, and today I'm going to answer a very common question that I hear in the clinic, which is, am I a good candidate for LASIK or not? Alright, so LASIK is a type of corneal refractive surgery. It is done to correct a person's prescription. So in theory, you can go from having a prescription, you get LASIK done. It's a surgery where a simple flap is cut on your cornea. They flip the flap over, apply a laser to your cornea, removing some tissue, and therefore they're altering the refractive state of your eye. The flap is placed back down, and after that, you can see. So your refraction is just a fancy term for what your prescription is, and your prescription is determined by the power of your eye. So your cornea itself, that's going to be the front covering, and the lens behind it together, along with the length of your eye, that determines what kind of prescription you have. So all LASIK and refractive surgeries are doing is altering your eye's refractive power or ability to focus light, and making it so that you're not so dependent on an external source of, lenses, either contact lenses or glasses. We're actually altering your physiology, your cornea, so that it corrects your prescription rather than doing that with lenses. So you might have wondered, am I a good candidate for having refractive surgery done? And there are actually 5 overall kind of criteria that we look at. Now, every case is different, and I recommend that you go by the advice of your optometrist as well as the referring ophthalmologist who would be doing your refractive surgery. But these are some broad categories for you to think about. All right, so number 1 is going to be your age. You do have to meet a minimum age requirement. Most surgical centers that I personally would trust are going to require you to be at least 18 years of age. The reason for that is that before 18, you're growing and changing, you're getting taller. Guess what? Your prescription is more liable to be changing during that time period as well. Once you've reached 18, your prescription should be more stable. You're not growing as much. You've probably reached your max height and all of that. So it's a much better idea to wait until you're around 18 before you consider refractive surgery. On the flip side, you might wonder, can I be too old for refractive surgery? So 18 is the minimum age. There are other considerations, but once you get past 40, 50, 60, now you're potentially needing some help up close as well. And it kind of depends what your goals are with refractive surgery. In theory, refractive surgery can be done well into a person's 60s, 70s, 80s, but it's going to totally depend on what your goal is. Because most likely at that point, we won't be able to correct both distance and near. Again, there are some exceptions to that. I would always bring it up with your doctor. Number 2, your prescription. So your prescription must be within a certain range. LASIK and refractive surgeries are most effective and best suited for folks who are nearsighted. So those are people who are fine up close but have some difficulty seeing far away. That being said, if you are too nearsighted, meaning your prescription is above a -9 or so, it can be more difficult to correct your full prescription. The same is true if you have a very high level of astigmatism. Astigmatism being that curvature of your eye, having 2 different curvatures to your cornea. If you get above about a -450 in your astigmatism value, it gets a little harder to do LASIK. Number 3, you need to have a stable prescription to be a good candidate for LASIK. So if your prescription every single time you go to the doctor is changing, going up, going down, you've had a lot of changes in glasses or contacts, you're probably not a great candidate. I personally like to see prescriptions stable for at least a year, within a half a diopter. So that is 2 clicks on my, called the phoropter, the machine we use to test your vision. If you're within 2 clicks consistently over the last year to 2 years, I feel confident that your prescription is stable enough that we can go ahead and correct it more permanently. Number 4, your corneal thickness. So I alluded at the beginning to the fact that your cornea is what's being altered in this surgery. We talked about the flap being removed, corneal tissue being taken away, and that's what changes that refractive power of your eye. So it goes to say you have to have enough corneal thickness to be able to apply the right amount of laser. If your cornea is especially thin and you have an especially high prescription, which means we need to take more tissue away, that's not a good situation for LASIK, because we would have to take so much tissue that it could make your cornea unstable. So expect your doctor to test your corneal thickness, compare that with your prescription, and use that as one of the criteria for whether or not you're a good candidate for LASIK. Number 5. So number 5 has to do with other ocular diseases. If you have a corneal disease, or if corneal diseases run in your family, that is the tissue where this laser is applied, where this treatment is applied. And so that's not a great, you don't want to be doing surgery on a tissue that's diseased. I have also found that by doing LASIK, it makes it a little harder for your doctor to manage glaucoma down the line. The reason for this is that every test we use to test your ocular pressure assumes a normal corneal anatomy, assumes a normal corneal thickness. When you have LASIK done, you are going to have a thinner cornea because we've taken tissue away, and it makes those pressure readings a little less reliable. So if you already know that you have glaucoma or that it runs really heavy in your family, you may think twice about having the surgery done. There are other diseases, of course, and all of these considerations have to be taken on a case-by-case basis. But these are the top 5 reasons, or top 5 guidelines that we look at when determining whether or not you're a good candidate for LASIK. Now the bonus is, do you want to have it done? And I have found that patients who are frustrated in their contacts or their glasses are the very best patients to have LASIK done. If you're totally happy in your contact lenses, they're very comfortable for you, they don't make your life difficult, your eyes are very healthy wearing contacts, then you can certainly do that long term. But ultimately, if your contacts drive you crazy, if you're sick of wearing them, if you're sick of doing glasses, LASIK might be a good option. I hope that helped. Those are 5 plus a little bonus criteria for determining if you're a good candidate for LASIK. As always, this does not constitute medical advice. I would recommend that you talk to your optometrist about whether or not you're a good candidate, and always select a good reputable LASIK center in your area at the recommendation of your optometrist. Thanks as always for tuning in. We have new videos coming for you every Wednesday at 4 o'clock. If there's something specific you want to see, feel free to leave it in the comments below. Thank you.